As far as the sharing of Medicare payments is concerned, I do not know their contract because I'm not privy to looking at that, and there's probably a gag order on seeing it. But in most cases, if it is a hospital base that provides the technical, they bill for the technical charge. And the professional, in this case, Moffitt with their one radiation oncologist, would bill for the professional charge. And the breakdown of that distribution, and I'm speaking as a physician who's dealt with this for 30 years, is normally 70 to 30 ratio or 75-25 ratio. That is, 75% goes to the technical and 25% goes to the professional. Now in this area, I get the same reimbursement that a not-for-profit gets. And we have not had any difficulty in being able to fund for that. But let's just say that the sharing is not a percentage basis, it's probably divided by contract. Now, as our most recent ad on Sunday's paper had indicated, that is more better, the effect. The cost of radiation treatment is significant. In order to provide this service, a threshold number of patients must be served. If you have less than that number of patients, you can't cover your overhead. And so as a result, you dilute both the professional and the technical excellence, and you incentivize two untoward events to occur. The first one is you cut staff. I will never do that. The second thing that I will never do is to increase the complexity of the treatment that's being given. Because you see, unlike going to, let's say, a restaurant where you can just look at prices and decide which one is the best deal, in this area of medicine, you can't decide. If someone wants to maximize their profit and bill Medicare more, all they do is increase the complexity of the treatment you're getting, and they can bill for more, which you see merely drives up the entire cost of medicine, not once reducing side effects or increasing cure rate, but definitely increasing the reimbursement. Does that make sense? Well, I was talking with one of the administrators in the villages, and he raised a very good statement. I know he didn't know the answer, nor did I. He said, well, let's compare Clearwater to the villages. I mean, after all, it's city about the same size, age population about the same. How many treatment machines do you think they have in Clearwater compared to the villages? I had no earthly idea, but I found out. The next day we called the state of Florida to find out what the ratio was. And we found out that the villages has 1.5 times as many treatment machines as the city of Clearwater. Now, if one dilutes the number of patients that you need as a threshold to maintain the quality of that equipment, then I would imagine that donations would definitely become an important part to offset not reaching that critical number of patients. Let me give you a little history of me. I went to the University of Florida's residency program, and when I go back almost 30 years ago, I remember that as a resident, I was strongly encouraged to tell patients who came from out of town that they really needed to stay there for their treatment. They were told that we were the experts in this area, and if they really wanted the best treatment, they had to get it there. I didn't engage in that because I knew that there were excellent graduates that came out of the University of Florida practicing in areas that these patients were coming from. For example, Orlando. The first graduate in radiation oncology coming out of the University of Florida actually started radiation therapy in Orlando, Tom Sawyer, and he was an excellent physician. There was no reason for those patients to have to travel. And yet that has continued, and it bothers me. And more recently, I've actually gotten that from the Moffitt as well, because representatives there have said to patients, you know, the only way we can be assured that you're getting the right amount is to be here. Because if you were treated somewhere else, you may not get enough radiation, or you may get too much. And the only way we can be assured that you're getting the right amount is to be treated here. Well, that representative obviously forgot that between May of 2004 and April of 2005, the Moffitt Cancer Center over-irradiated 77 brain tumors, giving them 1.5 times the prescribed dose. 21 of those patients had non-malignant tumors, and they were expected to live normal lives. And by getting 1.5 times the amount, they will suffer the side effects of that for the remainder of their lives. Now, I am not saying that to disparage the Moffitt Cancer Center. It is an excellent institution. But when you take someone's situation at the most vulnerable time in their life, and you manipulate those circumstances to influence their decisions falsely, I see that as wrong. And that's the comment I'm making. It's an excellent institution. They deliver excellent care. But not only as villagers, as human beings, we have certain responsibilities to you when we render care. And I think the first one foremost is just this: honesty. With the Moffitt, as far as telling them that they're actually engaging in a duplication of resources across the driveway, with you as residents of the villages being informed initially that this equipment wasn't here. You would have to travel out of town or maybe even 100 miles to find it. With the number of actual physicians coming of being actually 1, with more than adequate numbers of machines already present, with patients' treatment decisions manipulated at a time in their lives when they are most vulnerable.